I'm Sarah Coupland. I'm the, thank you, academic lead in Pathology in Liverpool, and I'm presenting this work on behalf of Mei Soon, who is an intercalating medical student and who's done this project as one of the 3 projects that she's doing during the so-called MRES. So uveal melanoma is a rare tumor. I see a lot of them in Liverpool because we're a super-regional referral centre for adult ocular oncology. The treatment of the primary tumor is usually successful in most cases, but unfortunately approximately 50% of the patients develop metastases, typically to the liver, and at the moment there is no cure for metastatic uveal melanoma. So there's no standard of care, and unfortunately the patients usually pass away within 6 months after they've developed the metastases. And it's just important to note that uveal melanoma is completely different to skin melanoma. Okay, so there are a number of different prognostic factors for uveal melanoma, which are clinical, histomorphological, and very strong genetic ones. And it was described in 1990s that if you have loss of chromosome 3, either complete loss of chromosome 3 or partial loss, this is associated with a poorer prognosis, and it's really quite distinctive. And if you add then together loss of polysome 8q, then these tumors are highly metastatic. And unfortunately, the patients typically develop metastases within 2 years. We were involved in the TCGA study, which looked at 80 primary uveal melanomas, and it demonstrated that you could subdivide these tumors according to copy number variation, chromosome 3 and 8, but also the presence of an inactivating BAP1 mutation. And if this is present, which is typically present in about 80% of the metastasizing tumors, then there's a very high risk of metastasis. And you don't have to do the genetics to look for the BAP1 mutations. You can use immunohistochemistry as a surrogate marker, looking at the presence of BAP1 protein in the nucleus. So that's the background, and what we're also interested in, perhaps if I go back, is the inflammatory infiltrate, particularly lymphocytes and macrophages within uveal melanoma, and also the metabolomics. And we looked at Adipophilin, which is a lipid, which is, the gene associated with it is PLIN4. And we found that Adipophilin is present in uveal melanoma cells. And we thought that we'd do a test run, and we have a very well phenotyped ocular oncology biobank, where we have all of the clinical data, the genotypic data, and the outcomes of the patients. And we looked at the Adipophilin expression, and this was done by Carlos and Mei Soon, who are pictured here. They did this by whole slide scanning and the digital analysis, and they found, interestingly, that, and they used these various programs to analyze the data, they found that disomy 3 uveal melanomas had a higher Adipophilin content, and similarly in the BAP1 mutated uveal melanomas, there was no statistical significance when it came to looking at chromosome 8q. They also looked at the TCGA data in terms of the expression of PLIN2, and found that our results were concordant in that the PLIN2 expression was increased in the disomy 3 and BAP1 mutant, non-mutant tumors. When we looked at the outcomes of the TCGA 80 uveal melanomas, we saw that the PLIN2 was associated with the prognosis. Furthermore, when we were looking through the slides, we found out of interest that the Adipophilin was not only within the tumor cells, but also within the macrophages. And this was particularly the case in the epithelioid uveal melanomas, where you have these macrophages essentially wrapping around the tumor cells. So Mei Soon went on, together with Carlos, and they did a range of immunofluorescence staining, where they did double and triple staining, and found, you can't really see it, yes you can at the top, that the BAP1 mutant uveal melanomas tended to have a higher macrophage infiltration, and that it is known to be associated as a poor prognostic marker, and the macrophages themselves were full of the adipophilin, which could be then measured using various software. So this is a very short whistle-stop tour of this project. What we're planning on going on to is using mass spec and trying to determine what are these lipids within uveal melanoma and why is it that they're associated with the macrophages and the association with the metastasis. Thank you very much. Questions?
Any question? Can I ask you? Yes.
That's very interesting. Do you think there's any relationship with the HLA class 1 changes that have been associated with uveal melanoma?
Probably, yes. As you know, the HLA-DR positive macrophages and the high density of macrophages within uveal melanoma is associated with worse prognosis. We haven't looked at the HLA status of these patients or the tumours, but that's something that we can move on to. Yeah.